Hi, my name is Debbie Komisak. I'm doing this reflection on the physical assessment in Shadow Health assignment. Coming into Shadow Health, I was a little intimidated after reading some of the posts in the American Sentinel Facebook page with the students post things about. There were a lot of posts about Tina Jones, and I wondered just who was this Tina Jones that everyone spoke about, and not always in a positive way. I came in to Shadow Health courses a little scared. Reflecting over my time spent on assessment during Shadow Health brought back many memories of being in nursing school, young and eager to learn what assessments were all about. I feel this was a beneficial course to me since I've been out of school for some 30 years. The regimented head-to-toe assessment is a pinnacle to practicing nursing and in a structured, uniform way. Upon meeting Tina Jones in the Shadow Health simulation, I felt like I liked her. Um, she was nice and polite, and not to be feared like I thought she would be. Having to do a systematic head-to-toe assessment on an adult was a little different from for me, it could, because in my career I have done all pediatrics for my whole career, and it is that population that I feel most comfortable with. Um, anyway, Tina's history of asthma was something I could relate to with my pediatric population patients. Most of our peds patients were type 1 diabetics, but still relatable to Tina's type 2. I liked getting the history from Tina, and she was a good historian, which isn't always the case in the real world. Sometimes getting a good history is a challenge in itself. Moving on to her systems and assessment, I feel like I learned the most by doing the cardiovascular system. A lot of the points of the heart that need to be assessed I had forgotten. So a good overview of and refresher of everything that goes into a cardiovascular assessment. The respiratory and abdominal systems were a good review, as was the musculoskeletal and neuro. I feel so much of the human body is a complicated, separate yet intertwined in the way everything works together, and having the knowledge and skills to know all the key assessment tasks is so beneficial to the nurse and the patient to get a good overview on the patient's health. The discharge of Tina from the hospital was enlightening. It showed how much teaching lay people need just to go home when they have wounds and medications and an illness to manage. Also reminds us that after the patient is gone from the hospital, a lot of care still needs to go on, and the people still need to deal with their illness at home, and how important nurses and home care is to the continuation of nursing care long after the patient is discharged. Overall, the Shadow Health experience was a good one, and I definitely got a good review of a very pertinent facet of my nursing practice. Thank you.